Hi, today we're going to present on the marketing strategy for XIENCE, Alpine, Everolimus, Eluting coronary stent. So this is a dynamic team that worked on this project. Myself, Bahawa, I'm a scientist, Cynthia is a pharmacist, and Sidra is an orthopedic surgeon. The presentation will focus on an overview of the market, the marketing mix, the 7Ps, the XIENCE systems, product itself and how it works. Then we'll look at cardiac stent evolution, areas of improvement, recommendation for market entry, and finally references. So the coronary stents market, a promising outlook. So the Vision Research Report is a market research and consulting firm that provides in-depth market intelligence. So they've researched and they found the market size in 2021 was worth 8.8 billion. The revenue forecast for 2030 is about 12.3 billion. The growth rate from 2022 to 2030 has a CAGR rate of 3.97. This market has some key players like Abbott, Boston Scientific, Medtronic, Terumo, and many more. The marketing mix 7Ps is a valuable framework to guide the launch and the ongoing promotions for science stent systems. First will be product, features, benefits, and value proposition, price strategy, and affordability. And then place would be distribution networks, promotions would be reimbursement strategy, people training programs, and then processes would be customer support, and physical evidence would be longevity. Now let's look at the product. Abbott Vascular, a part of Abbott, owns more than 30 patents for the Xavier family of stent systems. It's intended to treat narrow blood vessels caused by CAD. The features is a drug-eluting stent coated with Everolimus cobalt chromium that allows various constriction sizes. Its benefits, it improves blood flow, reduces restenosis, which is the narrowing of the arteries, specifically designed for high bleeding risk patients. Value proposition, it enhances safety and efficacy compared to the bare metal stents, especially for patients with complex medical needs. So, how does it work? PCI is a minimally invasive procedure. The drug-eluting stent is mounted onto a tiny balloon. This thread through the arteries until it reaches the narrowing of the heart. And once positioned, the balloon is inflated, expanding the stent and pushing it against the artery walls. This opening blockage and allows the blood to flow normally. The balloon is deflated and removed, which leaves the stent in place. The stent acts like a scaffold holding the artery open. The drug-releasing form of the stent helps the body heal the vessel wall around the stent, also making it less likely for the artery to also narrow again. Everolimus is actually first clinically trialed in the 1990s to treat cancer. Currently, it's FDA approved for treating multiple forms of cancer. It is not approved to treat CAD independently. So Everolimus' mechanism of action involves inhibiting the mTOR pathway. Inhibiting the mTOR, Everolimus might theoretically work by reducing inflammation in the artery walls and slowing down the growth of existing plaque.
The first generation of cardiac stents involved a stainless steel scaffolding with paclitaxel and sirolimus as drugs coating. The second generation was a cobalt chromium scaffolding with polymer coatings and drugs such as Everolimus and Zodolimus. XIENCE is Everolimus. The third generation involves drug-eluting stents with biodegradable polymers and bioabsorbable scaffolds. Though cardiac stents have had tremendous impact improving patient quality of life and have an excellent track record of success, there are clear areas for improvement. The first is increased longevity, as beyond 10 years these stents have shown signs of failure and restenosis. Affordability, which is particularly important as we consider this in a global context, and extended applications for more use with one particular product, as right now there are several players in the market space. In terms of increased longevity, while the cobalt chromium scaffold of XIENCE has flexibility and long-term shelf life, and does have some biocompatibility, there are hypersensitivity issues. Ideally, you'd like it to have degradability after drug elution, which decreases the inflammatory response. Ideally, you'd like improved drug elution kinematics And ideally, you'd like to minimize the chance of restenosis and late stent thrombosis. This is done by recovery of vessel vasoreactivity as well as restoration of endothelial function to function most like a normal vessel, which minimizes complications and minimizes malapposition to the vessels. Of course, affordability is huge, particularly in the global context. First, there are clear cost savings in the transition from the hospital to the ASC market, and in some instances, even into an outpatient office setting. Of course, the main objective is to minimize the complications as well as contraindications of several stents and have one particular stent that can have more broad application throughout indications for cardiovascular disease. Ideally, you'd like expansion in developing nations as there's increased healthcare expenditure per capita. There are favorable government initiatives and there's clear improvement in industry performance. However, there's several local players and there are government reforms that do dictate prices, which is a limiting factor, and there are obviously always threats to steady expansion. XIENCE was transitional at that time as it adjusted a multi-platform link for improved strength. However, there are clear use for expanded applications for one particular stent, such as bioresorbable technologies, biodegradable polymers, an improved catheter delivery system for elution drug efficiencies, as well as expansion from the cardiovascular disease into the peripheral vascular disease market. Ideally, a broad size range with different sizes at both ends can handle pretty much any vessel that comes its way. And there are clear improvements with AI enhancing imaging tools and diagnostics to minimize stent malapposition, which improves the chance of restenosis.
The medical device industry is competitive and requires a strategic approach. The next few slides will review some recommendations for successful market entry. First, for any product to even consider getting into a particular market, understanding the market and identifying target customers is key. You also want to analyze the competition and promote yourself as a worthy competitor. This would entail developing a strong brand identity and creating a product that differentiates itself from others. Some examples include stents that release new drugs, improved delivery systems, or incorporation of bioresorbable materials. Next, you want to ensure that your new product is available and cost-effective for both providers and patients alike. It would be beneficial to start the process early to obtain a new CPT code, as the application can take up to 2 years. It's important to take into account price-sensitive countries who may struggle with affordability of new, expensive products. In addition, you want to build a strong sales team to effectively promote and sell your stents. You also want to establish a reliable distribution network to allow and ensure timely and efficient delivery to healthcare facilities. Lastly, to ensure that the stent is well received by the public, you may want to offer training and support post-marketing and procedures. In addition, it's important to continuously monitor and improve your manufacturing processes, product quality, and customer feedback. Drug-eluting stents are considered major advancements in cardiology, and we will likely be seeing many more similar products in the near future. These are just some recommendations for how products can increase their chances of successful market entry. These are the references we use. Thank you for watching our presentation.